Hi guys, Dr. Gillard. Now I just got done doing my lecture on the cervical radiology section, which will be, a few questions will be on your final. Turns out it's 50 minutes long. It's going to take a long time to upload. And I know my section actually has the test tomorrow. So I'm going to try to do a really quick version of it. I encourage you to go listen to the full lecture though, because this is going to be the foundation of your x-ray to come. So it's an important lecture. But let's see what we can do, just kind of getting to the meat and potatoes of things. So here we go. Okay, so we got a cervical curve. Everybody knows lordotic cervical curve. We're going to be looking at the cervical vertebra. So here they are from the side. So let's take a look at this. This is the atlas, C1. This is axis, C2, C3, C4, C5, C6, C7 here. T1, which has the biggest spinous process in this specimen, is, well, this is T1. You can actually see the costal tubercle right here, a facet for the rib articulation. Let's see what we can see in parts, because that's what you probably care about, what's going to be pinned on the test. So here's a transverse process of atlas, spinous process of atlas, posterior arch of atlas. This is actually not the spinous process. This is the posterior tubercle of atlas, right? Posterior tubercle of atlas. Anterior arch and tubercle kind of combined. You can't really tell. Can't really see the lateral masses from this view well. So C2, what can we see? We can see an inferior articular process, which has the inferior articular facet on it, if you will, or articular surface or hyaline cartilage. Together this makes up the what's called the lateral atlantoaxial joint. Lateral atlantoaxial joint. Now we have a spinous process and a lamina. We're going to see a spinal laminar line, which is very important. All right, there's a, right here, what do we have there? You can see them here. That's a transverse foramen. Okay, that's not the intervertebral foramen. Transverse foramen. Okay, next. So that's C2. Here's the body of C3. This is the articular pillar of C3. Articular pillar, all of this, of C4. Articular pillars of C5. You can see the transverse foramen or foramen transversary. You can see the holes right there. That's for the vertebral artery to go through. Let's see. Spinous processes would be here. Lamina would be here. You can actually see a very nice line, spinal laminar line on radiograph to show that better, but it would be right in here. Transverse process. You can see it. Transverse process is actually quite complicated. Let's go to a bigger view here. I think I have a blow-up view. Let's look at this transverse process a second. So this is the vertebral body here. Here's the front. Back is over here. You can see the facet joints right here. Okay, so if that was tagged right there, that would be the inferior articular process. No, superior articular process here, inferior articular process here. The actual facet joint would be right here. Now we have the neuroforamen or intervertebral foramen or IVF. And you can see the transverse process is made by two roots. There are two shoots of bone that grow out. And at the end of these roots, you have a tubercle, anterior tubercle, posterior tubercle. Sometimes you can see them okay, sometimes you can't. And the interconnecting bone between the anterior and posterior tubercle, that has a special name, intertubercular, because it's in between the tubercles, intertubercular lamella. So this would be the intertubercular lamella, which also the whole groove, the whole space in between the roots can be called the neural groove, which is the groove for the spinal nerve back here. Spinal nerve splits and the anterior ramus continues out here, or the ventral ramus. Posterior ramus jumps out of this neural groove pretty quickly. Now the lateral part of the vertebral body in the cervical spine has a raised up lip like section, and that's actually called the uncinate process. And it articulates in a what many believe is a true diarthrodial joint, although there's still a little contrary about whether or not it's a true diarthrodial joint. But it does have a capsule, and there's some synovial fluid in here, some research says. And it's responsible, it allows the cervical spine to flex and extend. It keeps the stability with flexion and extension. Here's a better looking one right here. This is the uncinate process. The whole ball of wax is called the joint of von Luschka, or the omcovertebral joint. I think is probably more common. I learned it as the joint of von Luschka, but know both of those for board terms. You know, your chiropractors, you're going to have to be experts in all this stuff. Intervertebral foramen again, facet joint, boom. What are these holes? Those are nutrient foramen, I believe they're called. They're just where some of the arteries go in and feed the cells of the bone. So you can take the little quiz here. I think we covered everything. I'm going to give you the PowerPoint or the PDF version of the PowerPoint too, so I'm not going to spend too much time here. The only interesting thing I wanted to show here, the intertransversary muscles, there's an anterior and posterior division of them. They actually connect to those tubercles. So that's how you get some lateral bending motion of the cervical spine. And then notice that there's a nice little ligament here, the fibrous connective tissue, that actually kind of stabilizes the ventral ramus, aka anterior primary division, ventral ramus, as it goes through the neural canal there. All right, if we do a mid-sagittal cut, which is a little bit off center, we actually see the orientation of the facet joints of the cervical spine. You're going to be adjusting these, so notice that there's an I to S tilt. Here's the front, here's the back. So you want to include a little I to S in many of your cervical moves to take this into account. You don't want to just jam them posterior to anterior, but now I can't digress. I got to move quick in this one. Okay, so here's a radiograph of the cervical spine. Let's go through some parts that could be tagged. So here's the atlas. You can see the anterior tubercle superimposed. The anterior arch should be back here. Posterior arch is this whole thing here. Remember, it's not called the spinous process, even though we still call this the spinal laminar line. Here's another spinal laminar line. Another one, another one, another one, another one. That's an important line of stability there. So, posterior tubercle of atlas. Spinous process of C2. So this is the lamina of C2. This is the body of C2. Superimposed over the pedicle, and the transverse process would be right here. See it right there? You have a dens right here, kind of hard to see, but it articulates with the posterior arch of atlas. A ADI space is here. You'll learn more about that in your real radiology classes here. This is the mandible. Okay, so this is the body of the mandible here. You can see the angle of the mandible right here, and this is the ramus of the mandible. You have the coronoid process is kind of superimposed on the maxillary, or the air sinuses here. Sphenoid air sinuses are here. Maxillary air sinuses are here. So kind of hard to see that. The condylar process, the head of the condylar process fits into the condylar, or the mandibular fossa, to make up the TMJ joint. It's a real important structure right there. You should know what this is as well. This is for the pituitary gland. See this little cave? That's called the sella turcica. Sella turcica. Let's continue. Body of C3. Now I didn't mark these, but these are fair game. See these little areas of increased bone density here? Here's a better one. Those are the transverse processes superimposed upon each other. Okay, so transverse process, these are all the bodies. So here's the inferior end plate, superior end plate of which number? Well, here's 2, here's 3, here's 4, so it's C4. And here's the hyoid bone. Here's the trachea air shadow here. Epiglottis would be in here. Okay, so this space right here, you'll learn this next quarter, but that's the oropharyngeal space. Nasal nasopharyngeal space is up in here. Okay. Let's see what else we got. Articular processes here. Or that's called the oral pharynx. That was still in my mind. Nasopharynx or pharynx, however you want to say it, goes to about here, about to the uvula, and this region right here would be the oral pharynx or oral pharynx. There's a laryngeal pharynx as well, but kind of neat to see. Vocal folds would be right here, or vocal cords. Okay, I'm digressing. Let's stay on point. Articular pillars are right here. This is tagged right here. Superior articular process of, got to count them, 2, 3, 4, 5, 6. Superior articular process of 6. Spinous process of 6. Do I need to say anything else? Mastoid, I want to show you the mastoid. Well, look at all these soap bubbles. Mastoid, air cells, and here is the mastoid process coming around. Got it? Here's another one. What's this bump? Good. External occipital protuberance. Next. Okay, I'll let you go through these yourself. You have the worksheet here. Let me make sure I got them all. Okay. Lines of stability. You have the anterior longitudinal ligament would be running in the front. You should have seen this in class. By the way, this patient's jaw was fractured. That's why those screws are there. Posterior longitudinal ligament. You always make sure that these bodies and these lines are there. And this spinal laminar line is super important as well. So make sure these are all intact. Okay, look at this one. Really quick. I explained this a lot more on the other ones. But look at the spinal laminar line here. Looks good, looks good. I could draw a line here. Whoops, where'd it go there? Here it is up here. Here it is up here. So this is obviously, this is an anterolisthesis. This is a facet dislocation. So not a good thing, very dangerous situation. Facet is one of the facets, it turns out. Jump the tracks here. You can see this better on CT, but yeah. And there's also, you notice, here's the atlas. You can see both posterior arches here, both sides, because the image was taken, the patient's head wasn't correct. So you can see the body of the ramus here and the other body of the ramus here. These should be superimposed for a good image. We got real severe disc space loss here. And then we got something weird here. Where's C3 and C2? Where's the disc? Well, here's C2, the dens. There's the disc space, not much of a space. So this is a congenital fusion of C2 on C3. Congenital fusion. Okay, let's jump into the anteriors here. Let you look at that for a minute to get your bearings. All right, let's go through it. So we have transverse process of atlas. Okay, this is that lateral atlantoaxial joint right here and right here. The dens is behind, coming up like that. It's behind this structure. That's the anterior arch. Lateral masses of atlas are right here. Lateral masses of atlas, transverse process of atlas, transverse process of axis right here. Transverse process of axis. Now we have these cool joints here. You can really see them, these points. These are called uncinate processes of the oncovertebral joint or the joints of von Luschka. You can really see them nicely here and here. Remember I said that these allow flexion and extension. They kind of stabilize flexion and extension of the cervical spine. There's the disc space, and now we have the IVF, intervertebral foramen or neural foramen. Here's the trough we talked about before. Okay, look, here's a narrow trough. See that? That's the neural groove. For the most part, it's just for the ventral ramus. There's the posterior tubercle, anterior tubercle. You can count these down. That's 1, 2, 3, 4, 5. So this is body of C5, uncinate process of C5, transverse process of C5, but you got to be more specific. This is the anterior root of the transverse process of C5, posterior root of the transverse process of C5. At the end we have a tubercle. If the dot is here, that's the anterior tubercle of the transverse process of C5, posterior tubercle, transverse process of C5, and this is the neural groove. And remember, there's a special name for the section of bone between the tubercles, intertubercular what? Intertubercular lamella. Just like the lamella that make up the annulus of the disc. Lamella, intertubercular lamella. Here's a much wider groove. I think we got the point. There's a lip. The bodies often have these lips coming off them. You can read your text, Kramer, which you guys should have. That's a fantastic book, by the way. You gotta own Kramer and have it. It's evidence-based. I really like it, and I'm very finicky about my books. Okay, next one. Okay, covered that. Covered that. I'll let you go through that and quiz yourself. I made that so you can quiz yourself. Okay, X-ray. It's not an X-ray, right? It's a radiograph. Radiograph, we can see, what's this structure? Mastoid process, you can see the air cells in it. What's this bump? Well, that's the angle of the mandible right there. Put your finger back there and you can feel how it has a little divot and it makes it stick way out. So missing C1 and C2 here, but you can see these are all the articular pillars going down. So how the heck do you know which bone you're on? Well, you got to count up on this one. So these are obviously the first rib, number 5 here coming around. First ribs. They articulate with these transverse processes. So this has got to be, this is T1. Here's the spinous process. Here's a pedicle. Here's another pedicle. You can see the radiodensity making the pedicles. Okay, what's this big space right here, number 4? That's the tracheal air shadow. Here's the apices of the lungs here. Let's see some lung tissue in here. Lamina would be between the spinous process and pedicle, so all this region is lamina. Go up to number 7, it's here. Spinous process is here. Number 6, bifid, you can see both splits of it. Number 5 is here. So now you can see these, let's go up here. You see these little points, these little devil horns? Those are the uncinate processes of the vertebral joints. Got it? Disc space is right here, number 7. Okay, I think that should about cover that in this quick version. Okay, let's speed through this. You can go to the long version if you want to see more about this, but real quickly, okay, here's the first ribs, unquestionably. Or is that the first rib? What the heck is that? What is that? That's a rib. That's a rudimentary rib. So these are called cervical ribs. Not only that, the patient has hypertrophic transverse processes. Here's this transverse process, all this, pedicle of C7, pedicle of C7, spinous process, C7 is here, air shadow coming down, tracheal air shadow. Okay, but those are cervical ribs. This patient is at risk for a condition called thoracic outlet syndrome, where the neurovascular bundle, except the subclavian vein, can get compressed through a triangle created by the anterior, or by the scalenes with the clavicle and the first rib. We'll talk about that more in CCE4. Okay, trying to speed through this. I'm not going to go through this. You can go to the other tape to see this. We talked about all this already. Talk about this one. Here's the dens. This is a little confusing. Let's go to the special ones here. Here's an overhead of C2 axis. There's the dens, or the odontoid process sticking up. It comes off of the body, so the body would be giving rise to it. These articular, or these superior articular facets, kind of interesting here. Right underneath this, if I scraped a little hole, would be the superior articular process, and beneath that would be the actual pedicle. So the pedicle is actually kind of strange the way this works. The pedicle is actually giving rise to the superior articular processes and facets. Lamina, spinous process, what's this hole? Central canal, or the vertebral canal. Transverse processes are little stubs, but they still give rise to the foramen. I guess they want to call them, Kramer's trying to say, foramen of the transverse process, but still going to be transverse foramen, probably around for a long time, or foramen transversarium. It's where the carotid artery, or the vertebral arteries go. Vertebral body. Inferior articular facets are back to normal, and there we have that. Side view, I think we covered all this. You can just see the transverse. This is all transverse process though, because the transverse process gives rise to this transverse foramen. So this is, in order to see the top two bones, you need to take a special view called the A to P open mouth. So now we can see beautifully the dens, the odontoid process. So, and here's that lateral axial, or a lateral atlantoaxial joint. It's right here. These spaces are very important. The space between, what's this kind of triangle shaped bone here? All this. That's the lateral massive atlas. Another lateral massive atlas. Superimposed on it, you can see this coming around. Superimposed, that's the posterior arch of atlas. There's the transverse process of atlas right there. Got it? There's another one right there. Transverse process of atlas. Odontoid of axis, spinous process of axis. Coming off the body, you can see a piece of the body right there. Pedicles, see the increased density? Pedicles are the thickest part of the bone, so that's the pedicle. All right. Facet joint would be over here. Inferior articular process would be here. Superior articular process of L3 would, or C3 would be here. Here's the spinous process of C3. Teeth, obviously. Anything more I want to say? I don't want to say anything more about that. There's your quiz for you. What's going on here? Well, let's check. Anterior longitudinal ligament. Those look in line. Posterior longitudinal ligament, I could draw a line down here. They look in line. Let's check the spinal laminar line. Looks good, looks good, looks good. Whoa, what happened? It's way back here. Something's terribly wrong. Let's check the dens. Where's the dens? Missing. Here it is back here. So we got a type 2 odontoid fracture. Very, very dangerous. Patients needs to have surgery to rebuild this and stabilize this region. They may be quadriplegic. I'm not sure, but this is not good. Of course, you would never adjust something like that. Okay, well that will do it, and I hope this quick version gets to you later today, which is Sunday, I don't even know the date, but maybe the 12th or something like that, 2015 September. Good luck on your final. Where did it go?